Hello, radiographers. Hope you are doing good and learning from my YouTube tutorials and also my Facebook page. So, welcome to another tutorial video, and it's about MR angiography. And this is another interesting procedure, and you have a clear idea about this. So, let's start. So, at first, the introduction. So, let's know about MR angiography. And MR angiography is a procedure and it's a magnetic resonance imaging procedure that to obtain detailed images of the small bowel. So in MR angiography, we visualized small bowel through the MRI technology. And MR angiography, also called magnetic resonance angiography, is a complementary, advanced, accurate, and non-invasive diagnostic imaging test to evaluate a broad range of disorders, including Crohn's disease. So the common disease that happens in small bowel is the Crohn's disease, and it is diagnosed by the MR angiography. And what are the indications? The first indication is the low-grade small bowel obstruction. So sometimes bowels are obstructed due to various reasons, like any kind of tumor or sickness, sigmoidal, various reasons there for obstruction. And then small bowel masses, and then Crohn's disease. So Crohn's disease will come again and again in this lecture. So now the contraindication for MRI, you already know what are the contraindications, that electrical, magnetical, and mechanical devices are not indicated for MRI, like cardiac pacemaker. Having these machines, patients are contraindicated. Insulin pump, neurostimulator, cochlear implant, and hearing aids. So you have to careful about this. And then intracranial aneurysm clips, unless it's made of titanium. Some patients may have a brain surgery for their hemorrhage or stroke, and they may have intracranial aneurysm clips. And then pregnancy, of course, pregnancy should be assessed as risk versus benefit. So what is good for the patient, and then insist magnetic surgical clips or staples. So sometimes after surgery, the patient has surgical clips and staples. So unless it's made of titanium or an MRI compatible metal, MRI is contraindicated. And any metallic foreign body in the eye, that should be checked. And then metal sharpener or bullet. And now patient preparation. So there are some formalities before the scan, and it should be maintained, like a written consent should be taken before enter the scanner, and ask the patient to remove all metal objects, and there may be keys, coins, wallet, and jewelry or hearing or hairpins. And ask the patient to undress the change into a hospital gown. So, so this is common, that you have asked the patient to change into hospital gown, and it's safe. Patient dress may contain metal, like buttons and chains. Instruct the patient to hold his or her breath for the breathless scan, and it's better to coach the patient 2 or 3 times before starting the scan. So MR angiography protocols are mostly breath hold protocols. The patient have to hold his breath during the scan. So it's a good option to coach before the scan and consult with the patient and train him about this breath hold technique, how he will hold his breath and when. And then contrast and buscopan injection risks and benefits must be explained to the patient before the scan. So in MR angiography, contrast is used. So there are some risks of the contrast, gadolinium contrast, and there is benefit of the contrast. So all must be explained to the patient. Also, there is a injection called buscopan that will be injected during the scan or in mid of the scan. And what is the function of this buscopan injection? So we know that there is a motion in our intestine, and that is called the peristalsis movement. So to reduce this peristalsis movement, buscopan injection is administered. So the intestine moves slowly and we get good image and no motion artifact. And gadolinium should only be given to the patient if GFR is greater than 30. So before pushing the contrast or gadolinium, you have to make sure that the patient's kidney is functioning, and the condition of the patient's kidney will be assessed before the contrast is given and is measured by glomerular filtration rate, that is GFR. So if GFR is less than 30, gadolinium is contraindicated. An IV cannula must be set over the patient's hand, and through the cannula, contrast and buscopan injection will be given. And claustrophobic patients may be accompanied into the scanner room by staff member or relative with proper safety screening. So some patients may have uh, the fear of insert or enter into a closed space like lift or any cave. So MRI is one kind of closed space. So patient may have fear, and it's called the claustrophobia. So if the patient have claustrophobia, you may uh, allow patient's relative or patient's attendant into the scanner room, but he or she must be scanned before enter into the scanner room. And offer headphones for communicating with the patient and ear protection. So the headphones should be provided to the patients and also the attendants of the patient so that no hearing damage occurs, and explain the procedure to the patient and answer questions. So before the scan, explain the procedure, that what will happen and what the patient, how patient will cooperate you, like breathing technique and how much the patient will hold his breath, and also about the movement and also the drinking of the oral contrast. That if the patient want to know something from you, and gently answer the questions. And one of the important preparation is the patient should fast for at least 6 hours. So to empty our stomach and intestines, 6 hours is enough. And note down the height and weight of the patient. So height and weight is important because it will be registered during the patient registration, and the specific absorption rate SAR is calculated by this height and weight. And why oral contrast? So generally in MRI we don't use MRI and oral contrast, but in this case MRI angiography, this is a uncommon case, and for oral contrast we use, so what we use I will discuss later, but now I will discuss why oral contrast. The purpose of utilizing an oral contrast agent is to achieve specific signal intensities in the bowel lumen in different types of MRI images. So our target is the bowel lumen. So we have to intensify the bowel lumen by oral contrast. So on T2 weighted images, the aim is to produce a high signal intensity. So we know that in T2 weighted image, fluid is high signal, and on T1 weighted image, fluid is a low signal intensity. So if we can fill the intestine with the water, then we will get a positive contrast on T2 weighted and a negative contrast on T1 weighted. So that's the theme, but it's not clear water, and I will discuss it. And the low signal intensity on T1 weighted image is particularly crucial for identifying mural enhancement on post contrast T1 weighted images. So we know that T1 weighted image in T1 weighted image fluid is dark. So we will see fluid inside the intestine as dark signal. But when you give contrast, the intestinal wall will appear as bright, and it will give a contrast difference between the intestinal wall and inside the water. So this is very important to diagnose the intestinal wall pathologies like Crohn's disease and another any polyp and a tumor. So hope you understand the mural enhancement is the enhancement of the bowel wall, and in the background we can see the water as dark, but the bowel wall will bright because of the contrast. And now why not only water? So so let's know why not only water. Water is absorbed by our intestine very quickly. So if we give patient only clear water, the water will be absorbed by our body intestine and it will be excreted by the kidneys very quickly. But we need to hold or stay the water inside the intestine so can we can take the scans a long time, and the intestines are dilated also. So water alone is insufficient for achieving adequate bowel distension during MR endography. So only clean water cannot distend our bowel so much, and it is excreted very quickly and absorbed by our intestine. So what we will do? So however, when water is mixed with a solution containing mannitol or sorbitol, so mannitol and sorbitol one kind of saline, and these are mainly are electrolytes, having electrolytes in this. So if mannitol and sorbitol mixed with water, it makes a solution that is contained in or stay in our abdomen or intestine, and it better distend can be achieved. So it distended our intestine and it stays a long time in our abdomen. So furthermore, the addition of high level of metoclopramide to the mixture significantly enhances the rate of water evacuation from the stomach. So there is another thing that what is metoclopramide? What is the function of the metoclopramide? Metoclopramide increases the function of the stomach. So stomach empties quickly, and it also have another function. It reduces the chances of the nausea and the vomiting. So hope you understand that when patient drinks a lot of water or mannitol solution, then the stomach should function quickly to pass it through the intestine. And now the oral contrast. What is the oral contrast and the amount of the oral contrast? So we have oral mannitol 500 ml solution, and there is two 500 ml solution, that means 1 liter solution. And then 5 ml of metoclopramide mixed with solution. So I already discussed about the function of the metoclopramide. It increases the stomach function. So stomach empty quickly and push the mannitol to the intestines, and it also reduce the chance of nausea and vomiting. And now the technique to consume oral contrast solution. The patient should not drink all the mannitol solution at a time. He will drink it slowly and gradually. And the rules is to ask the patient to drink 1 liter mannitol solution within 30 to 40 minutes. Within 5 minute gap after each 200 ml. So that means the patient will drink mannitol gradually within 30 to 40 minutes, and the whole 1 liter mannitol solution will be drunk, and patient can give gap between 200 or 250 ml. And to ensure proper distal transit, we implement a minimum delay of 30 minutes from the initiation of contrast injection to the imaging procedure. So while patient drink all the solution, so after drinking all the solution, wait 20 to 30 minutes so that the contrast can reach the distal intestines. So that's the thing. And now the patient position. The patient position is in prone position with head pointing towards the magnet. So that means it's a head first prone position. So why prone position? Position the patient over the spine coil and place the body coils over the upper abdomen and pelvis. So this is about the coil placement. We know that the table have the spine coil, and place the body coil over the back and securely tighten the body coil using straps to prevent respiratory artifacts. And then give a pillow under the head and cushions under the legs for extra comfort. And center the laser beam localizer over iliac crest. And now is the thing, the why prone position is required. Prone imaging is highly recommended to improve gastric emptying and bowel loop separation. So when we position the patient in prone position, the patient feel pressure on the abdomen and stomach. So the oral contrast is spread all over the intestine, and also the because of the pressure, the stomach is empty quickly. And this is the position that the patient is lying in prone position, and head will enter the gantry first, and over the bed place the body coil and tight with the strap. And now the protocols, the first protocols will be the localizers, and these are the three localizers for enterogram. It's the coronal, sagittal, and axial. And you already see that the intestines are filled with oral solution and also the stomach. So these are not clear water, rather mixed with mannitol. And then take the protocols, and it's a T2 trophy phase corona, 4 millimeter. So this protocol will be planned over the localizers, and as this is a coronal protocol, so plan over the sagittal and axial image. So plan the coronal sizes so that the whole abdomen from anterior to posterior is covered. And also look at the axial images that the slices are parallel to the abdominal axial axis. And now take the axial 4 millimeter, and axial images will be taken in two steps in upper abdomen and lower abdomen. So there is two steps together. There is two slab. One is in yellow color. You can see the yellow color that's covering the from the stomach to the iliac crest, and another one is covering to the mid abdomen to the hip joint. And also look at the sagittal image and how the plan is given. So this is 2 axial 4 millimeter, and the next one is the T2 hast 4 millimeter coronal. And keep in mind that all the protocols are breath hold protocols. So before the protocol start, make sure that you ask the patient to hold his breath. And for hast coronal, plan on the sagittal and axial image like the previous coronal protocol, trophy coronal. And also there is a hast axial, and it's also planned the same as the trophy axial. And now this is a T1 Vibe Dixon headset, and it's a 3D coronal pre-contrast protocol. So this protocol is taken before the contrast is given, and it is very important to compare with the post-contrast images. And it's a 0.9 to 1 millimeter thin slice protocol, and it's a 3D protocol. So from this protocol, you can make axial coronal images, sagittal images as you want. And now break for the contrast and the buscopan injection. So before proceeding to the next step, intravenously inject 0.5 to 1 ml of buscopan according to the manufacturer's instruction and departmental policy. So buscopan injection is now given to the patient to reduce the peristalsis movement of the patient, and you can give it earlier before the scan, and you can also give it before the contrast is given. And the dose of the gadolinium is 0.2 ml per kg body weight. So it means that 1 ml per 5 kg body weight. So if the patient is 50 kgs, it can give 10 ml. So wait for 30 seconds before starting the next scan, as buscopan takes a few seconds to start its function. So after giving the contrast, wait for 30 seconds, and because the buscopan takes time to function, and then the post contrast protocols, T1 Vibe Dixon, the same protocol you took before the contrast, and the planning is same, planning on the sagittal and coronal. Actually, it's the planning is a copy from the previous one, and you have to take also T1 Vibe Dixon headset axial sequences, upper abdomen and lower abdomen. And now let's look at the images, how images looks like. So start with the T2 trophy coronal breath hold 4 millimeter. So this is the trophy coronal. So you can see that the small intestine is filled with mannitol solution, because as and also the stomach, you can see the stomach is distended, as this is a T2 weighted image. So that's the fluids are bright in this image, and the intestines are looking nicely. And these are the T2 trophy axial breath hold 4 millimeter. And also you can see the small intestines are filled with mannitol solution, and also the intestines are dilated. And now this is a T2 hashed coronal, and in hashed coronal also you can see the small intestines. All the intestines are filled with mannitol solution, and also the stomach is distended, because all the solution cannot reach the small intestine. This is the hashed axial breath hold 4 millimeter. In hash protocol T2, you can also see that the intestines are filled with mannitol solution, and it appears bright in T2 weighted images. And now it's a T1 weighted Vibe coronal pre-contrast. So it's taken before the contrast is given, and you can see that the in this T1 weighted sequence, coronal sequence, the intestines are dark, because the fluid appears dark in T1 weighted images. So, and you can see also the intestinal walls here. And now the post contrast T1 Vibe coronal. So in this image, you can see that the wall, intestinal wall or is increased, intestinal wall is enhanced with the contrast, and this is called the mural enhancement. But inside the intestine, there is water or mannitol solution. The water appears dark, but because of the contrast, the intestinal walls is in hyperintense signal. So protocol is very important to assess the Crohn's disease and intestinal tumor and intestinal pathologies will appear in this for post-contrast T1 diagonal sequence. So this is a T1 biaxial post-contrast. So in axial image, you can also see that the intestinal walls are enhanced with the contrast, and inside the intestine, the water or mannitol solution appears dark, and you can see that the kidneys are dilated. So kidneys are enhanced with the contrast, and this is a uterus. Uterus is enhanced with contrast, and this is the abdominal aorta and inferior vena cava. And there are some complications of enterography, like mannitol may lead to certain discomforts in the gastrointestinal tract following the procedure. So drinking a lot of mannitol, 1 liter solution, it has some complication, like patients may have diarrhea, excess intestinal gas, and abdominal cramps, and these symptoms may persist for a period of 1 or 2 days after the administration of mannitol. So after the procedure, tell the patient and reassure the patient that some complications may arise, but it will not stay. After 1 or 2 days, everything will be normal. And another thing will be Buscopan complication. Like Buscopan is generally well tolerated, but some may have complications. Like one of the major complications is the blood vision. So uh, patient may see blood spots few times, and which may last approximately 15 to 30 minutes after the procedure. So after the procedure, patient may see blood. So reassure the patient that it's temporary, not permanent. It will be all right. So nothing to worry. And additionally, buscopan has the potential to increase heart rate and may cause dry mouth. So because of the buscopan, there are two complications. One is heart rate may be increased, and patient mouth can be dry. So all these things should be consult with the patient and reassure that patient that can be happen. The patient is not feel anxious. So That's all. Thank you for watching. Hope you enjoyed this video. Hope you like this video. And please don't forget to subscribe my YouTube channel and also hit the bell icon so that you can get the notification as I upload a new video. And of course, hit the like button and share this video. Thank you.